Hi, I'm Dr. Jim Bianco, and I'm the President and CEO of CTI Biopharma, a Seattle-based biotechnology company that looks to develop novel targeted therapies to treat and cure patients with blood-related cancers. So our lead development candidate is called Pacritinib, which is an oral JAK2 FLT3 inhibitor that doesn't exhibit treatment-emergent myelosuppression as seen with other JAK2 inhibitors. And that product is currently finishing up phase 3 trials in myelofibrosis patients. And we heard at this year's American Society of Hematology meeting that Pacritinib may have a kinome profile that actually would have application potentially across a spectrum of blood-related cancers. Now we know that AML in particular, for FLT3 mutated AML, in about a third of patients, mostly elderly patients, that inhibiting FLT3 is a very interesting therapeutic target for treating those patients with AML. But in the setting of a JAK2 FLT3 inhibitor, much of the resistance that's conferred against just inhibiting FLT3 as a monotherapy allows us the potential to overcome resistance in AML models. And we'll hear some data at this meeting suggesting that Pacritinib actually can interfere with a very important relationship between the stromal cell and the leukemic AML clone. And if that data holds up in clinical studies, this may be a very exciting candidate for treating FLT3 positive AML in the future. And we have studies that are currently ongoing to examine that in the clinic. And probably the most provocative of data that we've seen in a poster presentation at the American Society of Hematology meetings is that Pacritinib's profile also targets two very important kinomes, one being the C-FIMS and the other being what's called IRAK1, which is the interleukin-associated receptor kinase. A lot of the focus at this meeting has really been on the tumor microenvironment. Stromal cells in the setting of leukemia, stellate cells in the setting of solid tumors, but most importantly, so-called lymphoma-associated or tumor-associated macrophages. And the focus on the macrophage has become critical because it is believed to be responsible for creating a tumor microenvironment that allows the leukemic clone to survive in a highly immunosuppressive environment, so that so-called immune cells, like effector T cells, really become inactivated in the setting of the stroma in that microenvironment, preventing the eradication of leukemia. So if one can target the microenvironmental changes, allowing the host immune system to actually have the ability to come into the microenvironment and eradicate the clone, that's a very exciting area for research in both hemo-immuno-oncology. And so some of the data that was presented today was that Pacritinib, by inhibiting C-FIMS and IRAK1, interrupts the stromal leukemic clone interaction, suggesting that in fact this could be a very important therapeutic not just for acute leukemia, but in the setting of nurse-like cells in CLL, or in the setting of similar microenvironmental cells for myelodysplasia, in particular for CMML, where IRAK1 is a very important target in potentially interruption in that disease pathway. And so we're really excited about the spectrum of activity that Pacritinib can provide across a whole host of hematologic cancers, and we're anxious to get exploring those in human clinical trials in the future.